How does sleep apnea cause polycythemia? If you're wondering how sleep apnea could be linked to polycythemia, you're about to uncover some fascinating connections between these two conditions. First, let's understand what polycythemia is. It's a condition where your body produces too many red blood cells, which can make your blood thicker and more prone to clotting. Now let's see how sleep apnea fits into this picture. Sleep apnea is a condition where you stop breathing for short periods during sleep. This can happen multiple times a night, and it reduces the amount of oxygen your body gets. When your body detects low oxygen levels, it tries to compensate by producing more erythropoietin, a protein that stimulates the production of red blood cells. Here's the key part. In some cases, this increased erythropoietin production can lead to secondary polycythemia. This type of polycythemia is not caused by a genetic mutation or a primary bone marrow disorder, but rather by the body's response to low oxygen levels. For example, people living at high altitudes or those with chronic respiratory diseases like COPD often develop secondary polycythemia due to the same mechanism. Their bodies are trying to adapt to lower oxygen levels by producing more red blood cells. In the case of sleep apnea, the intermittent lack of oxygen during sleep can trigger this same response. However, it's important to note that not everyone with sleep apnea will develop polycythemia. The relationship is more complex and influenced by various factors, including the severity of the sleep apnea and individual health conditions. Studies have shown that while sleep apnea can contribute to increased red blood cell production, it is not a common cause of polycythemia. In fact, one study found that only a very small percentage of patients with sleep apnea actually develop clinically significant polycythemia. Despite this, treating sleep apnea can sometimes improve blood counts in patients with polycythemia. For instance, if someone with polycythemia vera, a type of primary polycythemia, also has sleep apnea, treating the sleep apnea might help reduce the number of red blood cells and improve overall health outcomes. So to sum it up, sleep apnea can potentially lead to polycythemia by triggering the body's response to low oxygen levels, but it is not a primary or common cause of this condition. Understanding and managing both conditions can be crucial for maintaining good health.